சார் இப்போ இந்த காமனாக பார்த்தீங்கன்னா நிறைய இடத்துல வந்து இந்த யூரினரி ட்ராக்ட் இன்ஃபெக்ஷன் வந்து ரொம்ப வெரி காமனஸ்ட் இன்ஃபெக்ஷனாக மக்களிடையே இருக்குது. அதுக்கு வந்து பார்த்தீங்கன்னா ஒரு அதே அந்த காலத்துலேருந்தே ஒரு ட்ரக்கு காமனாக நைட்ரோஃபியூரன்டாயின் அப்படிங்கிற ஒரு ட்ரக்கை கொடுத்துட்ருக்காங்க. நான் ஒரு நிறைய பேஷண்ட்ஸ்க்கு பார்க்குறேன், ஒரு நார்மலில் ஒரு யூரின் கல்ச்சர் டெஸ்ட் எடுக்கும்போது அந்த ட்ரக்குக்கு பார்த்தீங்கன்னா எப்போதுமே அந்த ஒரு ரெசிஸ்டண்ட்டே நான் பார்த்ததில்ல. அப்படி அதில் என்ன அந்த ட்ரக்கோட ஒரு இதில் வந்து அது ஏன்னா இப்போ ஈவன் பார்த்தீங்கன்னா இனிஷியலாக எடுப்போம் ஒரு ஃபஸ்ட்டு விசிட்லேயே நம்ம பார்த்தீங்கன்னா அமிகாசின் கூட ரெசிஸ்டண்ட்டாக இருக்கும். பட் ஒரு நைட்ரோஃபியூரன்டாயின்கிற ட்ரக்கு வந்து பார்த்தீங்கன்னா ரெசிஸ்டன்ட் இது வரைக்கும் நான் பார்த்தது ரொம்ப கம்மி தான். ஆமாம். ஸோ அதை பற்றி நீங்கள் என்ன சார் சொல்கிறீங்க?
இல்லை, ஐ திங்க் தட் இட்ஸ் எ குட் கொஷன். பேசிக்கலி த யூனிக் ஃபியூச்சர் ஆஃப் நைட்ரோஃபியூரன்டாயின் is it exerts its action through multiple mechanisms. For example, even penicillin kills bacteria by damaging the cell wall. Even quinolones that acts against DNA gyrase. So each and every drug kills bacteria by targeting particular subunits of bacteria. But on the other hand, nitrofurantoin acts in multiple mechanisms. So basically, it is we consider it a prodrug. So in fact, it is converted. I think that in a by the reductase enzyme. But the most important is this intermediate product that is derived from nitrofurantoin. It damages the DNA. It damages the RNA. Even it inhibits the protein synthesis at ribosomes. Even I think that to some extent it damages cell wall. So what I try to say, since it exerts its beneficial effects through multiple mechanisms, so it kills bacteria by targeting many components of bacteria. That's the reason bacteria is not able to exert any kind of resistance against nitrofurantoin. But if you take other drugs, these drugs targets bacteria with one particular subcomponent. So over a period of time, bacteria trains its gun against particular antibiotic through modified protective mechanism. That is the main one.
So nitrofurantoin ஒரு multi targeted action is a reason for this resistance. Okay. ஓகே சார். அதே போல் இப்போ யூடிஐ பேஷண்ட் பார்த்தீங்க அப்படின்னா நிறைய பேர் வந்து அந்த கிருமி தொற்று வந்து கிட்னிக்கு டைரெக்டாக இன்வேட் ஆகிருது ஒரு அசெண்டிங் இன்ஃபெக்ஷன் மூலமாக. ஸோ அப்பையும் அந்த நைட்ரோஃபியூரன்டாயின் எடுத்துக்கிறாங்க. அது எந்த அளவுக்கு சார் அது வந்து ஒரு கிட்னி இன்ஃபெக்ஷனை கிளியர் பண்ணுமா இல்லை எப்படி?
இல்லை, நோ. ஆக்சுவலி வென் யூ அட்மினிஸ்டர் நைட்ரோஃபியூரன்டாயின், தி கான்சன்ட்ரேஷன் ஆஃப் நைட்ரோஃபியூரன்டாயின் இன் த சீரம் அண்ட் த கிட்னி அண்ட் prostate is very low. We used to say. That's why we call it as nitrofurantoin as an urinary bladder drug. So basically it is concentrated mainly in the urine. So it is not concentrated in the kidney as such. So if somebody has features of pyelonephritis, don't administer nitrofurantoin. Probably when you take urine culture sensitivity, so particular enzyme, particular organism, for example E. coli may be very much sensitive to nitrofurantoin in vitro. In the lab it may show sensitive, but what you have to remember that it is ready to act against even ESBL producing E. coli also. The problem is the E. coli nitrofurantoin concentration in kidney is very poor. So likewise in the serum also it doesn't stay back for a long time. So it is simply in the urine. So it is mainly recommended for acute uncomplicated cystitis only for 5 days. Okay. Suppose if you think that the patient has features of pyelonephritis or prostate infection, even when patient is in sepsis, so during these times you have to choose a drug which is specifically concentrated in the kidney. In the case of pyelonephritis, if it is concentrated in the blood, then only we can use it for bloodstream infection. And that's why we prefer quinolones for prostate infection, because quinolones are very much settled down in the prostate tissue. So my humble request would be, if patient has features of cystitis, you use nitrofurantoin. But when you think that you are dealing with pyelonephritis or prostate infection, or when patient is in urosepsis, don't use nitrofurantoin, even though it is capable of acting against particular organism through your urine culture.
ஓகே. ஸோ பேசிக்காக சிஸ்டைட்டிஸ்ங்கிறதுக்கு நைட்ரோஃபியூரண்டைன் இஸ் a preferred choice. Once it is complicated or some other
complicated
causes.
UTI, because it is not concentrated in in the tissues. So the deep penetration in the tissues is very poor. That quality.
Is there any contraindication for this drug, sir? How much so many pregnancies also getting the UTI frequently?
But it is relative. We used to say nitrofurantoin is a category B drug. We can safely use in the pregnancy, especially first trimester and second trimester. One relative contraindication, actually, if you use nitrofurantoin in the third trimester, something like after the after 38 weeks of pregnancy, or during the time of labor, or just after the delivery. So during these times, what happens when you administer nitrofurantoin, it may cross the placenta and it may get settle down into neonate. The problem with the nitrofurantoin is one of the drugs that will cause oxidative reaction. So naturally, nitrofurantoin causes oxidation of oxidation in the RBCs. So when you have good amount of G6PD, glucose 6-phosphate dehydrogenase, in the RBC, that can resist against the oxidative action of nitrofurantoin. If there is no G6PD in RBC, what happens? Nitrofurantoin is capable of producing hemolysis. It is the G6PD enzyme that acts or resists against the oxidative reaction of nitrofurantoin. Otherwise, hemolysis occurs. Naturally, neonates RBCs are very immature. So what happens? This immature RBCs doesn't contain G6PD. So G6PD is the enzyme that produces NADPH followed by glutathione. The glutathione is act like an antioxidant against the action of nitrofurantoin. When G6PD is not there adequately in the neonates, so what happens? The neonate RBCs are so much vulnerable for hemolysis induced by nitrofurantoin. That's the reason nitrofurantoin, we should exercise caution, especially in the late trimester and during the labor and immediately after the delivery. Then apart from that, when you administer nitrofurantoin for long-term purpose, for example, when you have recurrent urinary tract infection, urologists, they used to recommend 50 milligram at bedtime for 3 months, 6 months. When you administer for long time, patient can go for chronic hepatitis. Even it has been implicated in the precipitation of interstitial lung disease and so on. So when those who have been taking nitrofurantoin for a long time, better to monitor LFT, and you have to ask any breathlessness in view of interstitial lung disease induced by nitrofurantoin. Otherwise, I think that for short course of therapy, nitrofurantoin is almost a safe drug, I consider.
Okay, short course means
I mean the 5 days course, for uncomplicated cystitis. When you use for long term, like prophylactic dose, for recurrent UTI, 50 milligram daily once for a couple of months, then you should monitor the lung and liver very carefully.
Okay, sir. Thank you, sir. So nitrofurantoinலையும் நிறைய நமக்கு வந்து பாயிண்ட்ஸ் இருக்கு. அதாவது only for cystitis and it has a multiple targeted action. Like that, and it's only contraindication also very minimal only, so especially in the pregnancy late trimester. Thank you, sir. Thank you so much.